So I feel like when seeking mental health support for Gwen, one of the biggest challenges was took a lot of time because it entails making a lot of phone calls, being available for meetings during the day or just at the drop of a hat. You know, especially if the child's struggling, then it's really the role of the parents to get all the supports they can get by talking to teachers, emailing, phone calls, having meetings regularly with all the support staff at the school, whether it's just teachers, coaches, principals, IEP staff, you know, like a learning center or guidance counselor. And we did all that, and it really helped that everyone was on the same page and in looking out for Gwen's best interest.
I've had an IEP since the first grade, so I was kind of used to getting extra support, but I wasn't in the mental health area, so we definitely had to learn a lot and talk to different people because I didn't know half the resources before I was actually in need for them. And it was only when we kind of deep dive and made it apparent that this is something I'm in need of, then that we were then able to figure out what different levels of treatment the school allowed.
In the public schools, a school counselor you could go to, or there was even a school psychologist that you could set up time to speak with them. And they had different placements per whatever need your child had. And those would be, once they evaluate the child, usually from like an IEP meeting or something like that, then they could place the child for whatever best suits them. Sometimes though, say for Gwen, we decided that at the end of the day, maybe the best support would be for a smaller environment because her high school is very, very large, almost like 1,400 students. So we chose to take her to a private school that had only 30 students in her class, very small, but it was very nurturing. It didn't have, say, mental health supports per se, but their mentorship programs acted as that in a way that it was extremely supportive to Gwen. And I could also speak with the teachers at that school. They were, they really were attentive to each student. It was such a small school that they looked out for her and really wanted her to succeed. So I thought that was really great that we brought her to a smaller environment.
Yeah, and I would say that a huge thing that you did for me was teach me how to advocate for myself from a young age. I think that's so important because it is so important for parents to help you advocate, but if you need help immediately in that, if you're having a panic attack or just a depression spell in a class, it's a lot of times up to you to talk to your teachers or talk to the principal or guidance counselors about what you need in that moment. And without the support of my parents telling me that I need to put myself first and put my well-being first and take those steps to get that help, I wouldn't be as suited as I am today.
The advice I would give to parents, guardians, or teens is to seek out help first initially, just when you're struggling. Don't wait. Talk to a teacher or your guidance counselor, and also talk to your parents. So maybe they could even help you get the right supports if you don't know how to get them for yourself as a young teen, because it's important to get the help right away before things get more challenging for you as a teen in a school.
Yeah, and I would say that advocating for yourself as a teen, but also as a parent, advocating for your kid is essential. I think that's like the root of all good, just making sure you're able to get the support that you need. And then also for a struggling teen, a big piece of advice I would give is it's not going to be easy, but just don't allow yourself to struggle alone. Tell someone, tell a teacher, even if you don't feel connected to the guidance counselor or someone else, just make sure that someone knows, and that person is likely to then bring you to different resources or point you in that direction. Or at the very least, tell a parent.